How can they offer Medicare Advantage plans with $0 per month premiums? Gold. Hi, I'm Kevin Knaus with InsureMeKevin.com, and as you can see, I've been doing some prospecting in my backyard for gold, and I have not had any luck. Plan sponsors for the Medicare Advantage plans seem to have struck gold, but you know, it was kind of by design. And the question always comes up, how can these name brand insurance carriers allow me to enroll in a plan where they cover so many of my Medicare costs and the monthly premium is zero? Well, of course, most people are entitled to Part A hospital insurance for Medicare at zero cost, and then you pay your monthly Part B premium around $170 per month. Now, there is a ton of data when it comes to Medicare and the claims that they do pay. And these Medicare plan sponsors, they kind of bid to cover the original Medicare Parts A and B. And Medicare says, well, you know, there's a certain amount, because when it comes to insurance is risk. And the companies say, if you pay me so much per month, Medicare, I'll assume the risk and all the liabilities for that individual. And that's essentially what happens. The risk and the liabilities are transferred from original Medicare to the Medicare Advantage plan that you enroll in, and they handle all of the claims and assume all the liability for any major catastrophic open heart surgery or whatever it is that you may have. And for that assumption of the risk, Medicare pays what they call a monthly capitation rate to the Medicare Advantage plans. And I'm focusing here on California, and the way Medicare works is they break it down by county. And even though you may live in one county and go see, you know, doctors in another county, that's just the way the plans are organized, and that's the way they are paid. And so for 2023, I was looking at the lowest cost capitation rates and the highest amounts in California. So in Imperial County in California, for just a Medicare Advantage plan that maybe just new onto the marketplace, if someone enrolled in that new plan, Medicare would pay them $1,006.38 every month on that enrolled member's behalf. Now, if the Medicare Advantage plan, you know, gets good star ratings and has, you know, very few complaints and not put on sanctions, then they can make more money for keeping people healthy and doing all those things. So now in Imperial, there really isn't much of a difference, but you can see that as you go down the list, like Fresno, the capitation rate starts at $1,057.68 and goes up to $1,163.45 if they're doing a very, very good job. So at a minimum, if you're enrolled in a Medicare Advantage plan, Medicare is paying that plan at least $1,000 a month on your behalf. Now, these numbers do not include any prescription drug subsidy. And most Medicare Advantage plans include both your original Medicare Parts A and B coverage and that Part D prescription drug coverage. And that's kind of a separate component to the plans and a separate payment from Medicare. So this focuses just on the health. Now, on the upper end, you know, how much are the counties that are expensive? Well, Inyo seems to be the most expensive at a base of $1,379 per member per enrolled month in a particular plan, and upwards of $1,450 if it's a 5-star. It has the highest bonus rating. Los Angeles is, you know, near the top, but isn't the most expensive. That member for the capitation rate for Medicare Advantage plans is $1,178. Kind of a 5-star big bonus. They could make $1,240. So, and of course, not everyone who enrolls in a Medicare Advantage plan is really even going to use the services. So you can see how that money, they found some gold there. But of course, the Medicare Advantage plans do pay those large claims for people, and most of these plans do have maximum out-of-pockets, and sometimes they're very low, and the Medicare Advantage plans do work for those people, and they can offer other supplemental benefits, which I always thought was a little odd. How can the plans offer these extra benefits if the capitation rate is supposed to be covering, the risk of just your average person in the pool, but Medicare allows them to get away with it? Now, as a comparison, what do other Medicare Advantage plans in the country, what are they paid? The lowest monthly capitation rate that I could find from Medicare to particular county was in Texas. The county name is Presidio, and the introductory capitation rate was $850, and highest bonus $887. Maybe Texas, close to Mexico, maybe people aren't using as many services in the US down there. I mean, I don't know, I'm just speculating why it's so much cheaper, because these capitation rates and everything, it all goes to the cost of health care. So what doctors are paid, what hospitals are paid, labs, et cetera, and that all goes into the mix to create these capitation rates. The most expensive, this is the lower 48 states, a county, Niobrara, in Wyoming, $1,785. And a member, if they're in a plan that has the 5 stars and everything, could be paid $1,878 to the plan that they're enrolled in every month. Now, Wyoming, it might be kind of expensive to attract doctors. People don't really have any place to go. You can't go to really Canada to get health care any cheaper. So California is not the least expensive, and it is not the most expensive in terms of what Medicare pays the Medicare Advantage plans. But now you kind of know that you may be paying a very low monthly premium for your Medicare Advantage plan. Part of that, if it's a Medicare with a prescription drug plan, includes that prescription drug coverage. But a big chunk of it is for the Parts A and B, and it's $1,000 a month, and that's kind of how they tally up everything on the federal level. So now you know where some people are mining for gold in California Medicare Advantage plans. So for Insure Me Kevin, I am Kevin Knaus. So what I'll usually do is I'm digging up there in between the granite, get a pan full, and just start washing it down and see if I can see anything yellow in there. Usually a lot of fool's gold. This was a creek. Folsom Lake is just a couple miles to the east. American River would overflow. Water would come down this area here, and there was gold mined in the area. There was a lot of Chinese miners here in the 1850s and 1860s. And I'm sure most of the gold was already swept up, but you never know. In between the different pieces of granite that were kind of hard to move, there's been a lot of construction work here over the decades and whatnot. Things moved around, so you just kind of do some panning here, and I probably ought to stick with a better profession. Maybe I'll get involved with a Medicare Advantage plan, because that's where the gold seems to be. Oh boy.